and welcome to Smarter HR Solutions HR Cafe. My name is Nicole Bellow and I'm here today to talk to you about a hot topic. So today we're going to talk about FMLA. So I don't know if you guys, everyone is not really applicable to everybody, but if you have 50 or more people, you have to have an FMLA guidelines in place, or if you're like a public institution or something like that where they mandate that you have to have it regardless, then you would have to have FMLA. So as we know, that's one of those sticky situations where you have to make sure you're following all the guidelines to be above board to follow all of your federal and state regulations when it comes to FMLA. So a lot of times when we get people talking about people who have intermittent FMLA to where they're not taking it all at one time. So, maybe someone is out for their own physical illness and they're going to be out for 6 to 8 weeks. That's FMLA taken like in a lump sum. But sometimes people have illnesses that kind of come and go, and those illnesses are cared for on an intermittent basis. So someone might be sick 1 week out of the month, or they have to go for treatment or different things like that. And so they may have a more intermittent FMLA policy that they will be following those guidelines. And as an administrator, you have to make sure you keep up with those hours that they have. So we know if they've worked 1,250 hours, either on a look back, that they are actually eligible for their 12 weeks. So you want to make sure they can take these increments, and however small increments that they want, basically kind of guided by your policy. So if 30 minutes might be it, or an hour, they can take this amount every day or however they need to take it, as long as they have been checked out by their doctor, and the doctor can fill out the necessary form. So make sure you go by those forms. But guys, it is okay to recertify. If someone's on intermittent and it's been like 2 months since they've had to go out and they have to go out again, it's perfectly fine to go ahead and recertify. Or if they haven't gone out in a long time, it's okay to recertify every 6 months. But you want to make sure that the person's condition is still warrants whatever is on the FMLA guidelines. And sometimes you might find that they maybe are better off than they were when it first happened. So maybe they're not out as much, or they could possibly have something that's very chronic and having some situations where they have to be out more often. So I would definitely make sure you recertify. If you feel anyway that this information is not correct, you can also, reach out just to make sure that the documentation is correct and is authentic. That's really all you can say. Don't get into any of their personal information. Don't violate any of that information at all. But you can make sure that the information, the guidelines set forth are correct. So I will make sure that you always are, educating yourselves, your department managers on how to handle FMLA, and just know that their supervisor cannot call the provider and ask for any information on that employee. It has to be a designated HR professional or a benefits administrator, third party or internal, that actually is calling and making these calls, because you can get yourself in tons of trouble. Now FMLA, because of the tricky guidelines and what you can ask and not ask, it makes for a situation where there can be lawsuits because you're kind of not following those guidelines. So make sure you follow those guidelines. Make sure your people know to follow those guidelines as well, and to know when to offer FMLA protection. So if you know someone's been out for 3 consecutive days, you want to make sure you go ahead and say, hey, here's your FMLA paperwork. If this is going to be something you're going to be out for, give them the paperwork, have them, apply for it. If they're not eligible, there's a box to check, not eligible. If they are, you can put, how many hours are, that they actually have. So you want to make sure you're being proactive with that and offering it when you're supposed to offer it, and giving them the information that they need to go ahead and make sure they can use that FMLA benefits. Also, make sure you're coordinating those benefits with them as well if they have short-term disability. So if they're going to be out and short-term has a 5-day, 6-day waiting period, then you want to make sure that you can give them the information so they can start getting 60% or whatever percent that they've paid for their income, so they can kind of, be whole and everything's all right. Make sure that you keep their insurance going. They know they'll have to pay anything additional as if they normally would pay if they were actually there, but make sure that you keep that insurance going the way that it should. So these are just some little informational tidbits I wanted to kind of share with you. If you're dealing with FMLA at all, if you're dealing with any abuse, we can talk about that, or just really just getting down to how you actually administrate and what you need to do as an employer or administrator, carrying on FMLA benefits for your employees. So that's it for today on that part of FMLA. We know I can go on and on and on about FMLA and do's and don'ts and things like that, but for right now I'll just give you that in little bitty bites. So thank you so much for joining in, and I look forward to speaking to you soon. Thank you.